Hello, my name is Michael Jones. I'm president of the Medical Exercise Training Institute. And today I'd like to talk to you a little bit about medical exercise training practice management systems. Now, systems will set you free. And I know for many of you in medical exercise training, you have a background as a personal trainer. And for the most part, personal trainers like to do it their way. But folks, we here at the Medical Exercise Training Institute have provided our medical exercise specialist workshop and certification since 1994. We were the first ones to move into this realm of medical exercise and post rehab fitness. And as a physical therapist, I saw the need for someone to bridge the gap between healthcare and fitness. In the early 1990s, as we gradually started to see the reduction in insurance reimbursement for physical therapy services, we needed to find a way to transition our patients out of the clinic into an exercise setting where they could work with a fitness professional that had the understanding and knowledge with regard to how to apply exercise to medical conditions, hence the medical exercise specialist. Well, now, some 30 years later, we're faced with a different client, a more challenging client. The healthcare changes we've seen with insurance reimbursement reduction, as well as the changes we've saw with COVID, have now required that we institute medical exercise training practice management systems. And folks, contrary to what you may think with your background in personal training or fitness, systems can actually set you free. We realize for most personal trainers, you like doing things your way, but you'll realize with the more challenging client, you need to have systems in place to make sure you cross all the T's and dot all the I's, because now you have to communicate with doctors, therapists, chiropractors. And your clients aren't coming in just to simply get a good workout and a good sweat and lose weight. They're coming in because they have residual functional deficits. So today's presentation will look at MET practice management systems, and these systems will set you free. Now, we have 10 systems that we'll talk about today, and these are the essential systems you need in your medical exercise training practice. They include operations, assessment, client management, scheduling, billing, staffing education, marketing, documentation, medical relations, and communications. So I'm going to talk briefly about each one. The first one is operations. This system covers all aspects of medical exercise practice maintenance, equipment, computers, and any aspects of the physical plan. This system allows you to have a well-maintained, well-equipped, smooth-running operation. So it primarily is responsible for all the physical aspects of your practice. Number two, assessment. This covers everything from the initial assessment to reassessments and all the assessment procedures you'll use in managing the medical exercise training client. Now, remember, as a medical exercise professional, your job is to look for functional deficits and then to institute a program of training that will help the client improve on their level of function. Number three, client management. Now, this system looks at all aspects of the delivery of medical exercise training services, from the assessment to the reassessment to the actual training session itself, whether it be a group-based training session, a couples training session, or it be a lifestyle management program. So all aspects of the client receiving or having the services of medical exercise training delivered to them are covered under this system. Number four, scheduling. Now, all aspects of scheduling are covered here. Now, this means not only scheduling individually with a specific medical exercise professional, but also the ability for the manager or the supervisor or the owner of the practice to see all aspects of scheduling with each individual medical exercise professional and also with auxiliary services. And this system allows for the client being able to make appointments on their own, as well as going through the medical exercise professional via phone, text, or email to make appointments also. So this is our scheduling system. Number five, billing. Billing incorporates all aspects of revenue coming into the practice. So this looks at invoicing or billing for medical exercise training services, whether they be one-on-one services or group services or lifestyle management services, or even services that are provided in the client's home. Now, some of you are starting to deal with insurance carriers. So insurance reimbursement will fall under this category, but please make sure when you're seeking insurance reimbursement, you're doing it ethically and professionally, and you're only billing for those services that are within your scope of practice as a medical exercise professional. Number 6, staffing and education. Now, we hear this constantly from medical exercise specialists out there. They can't find appropriate staff members to work with their clients. Folks, this is where a system comes in place. And the system allows you to put in place step-by-step hiring procedures, step-by-step training procedures. And if everything in your practice is systematized, literally all you have to do is hire good people, not necessarily based on their skill, but based on their character and their personalities, and then simply walk them step by step through all of your systems. Folks, systems make hiring and firing much easier. Notice I said firing too, because sometimes you have to make sure you put clear-cut guidelines in place. And if people don't meet them, then they need to move on. Number 7, marketing. Now, I know one of the biggest challenges for you as a medical exercise professional is marketing your practice, because all day long you're working with clients. When is there time left for marketing? So having a system in place that says what you're going to send out as far as an email newsletter, what will be included in the email newsletter, what are the promotions that you'll run this month, this is something that needs to be done earlier than later. So instead of waking up on a Monday morning trying to figure out what are we going to do this week as far as marketing for the end of the month, let's put a system in place that says for every client that contacts you, there's a specific email that goes out to them. Then there's a follow-up email that goes out to them 2 weeks later if they don't actually register or sign up for sessions. So marketing, having a system of marketing, I should say, is probably one of the best things that you can have. Number 8, documentation. Now, with medical exercise training, as I said earlier, with this type of client, you got to cross all the T's, dot all the I's. You have to send reports to the doctor, therapist, or chiropractor. And if you're dealing with an insurance carrier, they're going to want documentation too. So you have to have a system of documentation that includes which forms will be used, what forms will be used at certain times, and then also specifically what will be documented. And then where will that documentation be stored? Now, documentation is very sensitive in that we have to follow HIPAA guidelines. We can't allow any documents to be left laying around in the studio or left in your car when you go in to see a client in their home. All documentation should be put under lock and key when you're not actually utilizing or documenting something in the client's file. This goes for both electronic as well as handwritten documentation. And every staff member needs to be up to speed on how to document, what to document, as well as what forms to use. Number 9, medical relations. Now, this is where we see a system is vitally necessary. For most medical exercise professionals, they want to work with every possible medical professional in the community, from OBGYNs to endocrinologists to orthopedic surgeons to cardiologists to neurologists to physical therapists to nurse practitioners. And folks, it's almost impossible to do that. So with your medical relations system, you need to have a step-by-step system as to how you're going to communicate or even approach a medical professional. Now, you may find with that, you also don't want to look at doing a shotgun method and trying to approach every medical professional in your community. It just doesn't work because there are just too many, and getting in to see a medical professional is very difficult. So we highly recommend that you have a target medical marketing list. And then with that list, specifics on how you're going to communicate with each individual medical professional. And that may change based on how they want you to communicate with them specifically. But please have a system for medical relations. And number 10, communications. Now, we already talked about documentation. Now we're talking about communication, and communication is any external communication that the practice has with outside physicians, therapists, chiropractors, insurance carriers, and even with the client. You have to have a system in place as to how that will be done. You also need to have in place medical release forms that the client signs authorizing you to communicate with their physician, their therapist, their insurance carrier, or whoever else they may want you to communicate with. As you can see, these systems become very important, and the systems allow you to produce efficiency. They make you far more effective. They also allow you to transform your business to a practice. A business is a bunch of one-offs. You're doing every day, you're putting out fires. If you put systems in place, it makes it much easier. That's when you transition to a practice. Systems also make staffing easier. Instead of having to tell staff members what to do at every step along the way, when you have systems in place and you've written down these systems, it makes it much easier for staff members to follow through and know exactly what to do. And systems allow nothing to go missing. So nothing is missed in a system. There are no things that fall through the cracks, and we produce a far better outcome with our clients. Now, remember again, medical exercise training practice management systems should include operations, assessment, client management, scheduling, billing, staffing education, marketing, documentation, medical relations, and communications. Now, you can get more information on these systems at our MedX Pro Network. Go over to www.medxpronetwork.com. Now, we realize for many of you, when we talk about systems, you're like, well, Dr. Mike, what do you mean systems? We'll give you more information when you go over to medxpronetwork.com. But let me make sure you understand. Medical exercise training is continuing to evolve. It's going to become bigger. It'll be more recognized over the next 20 years because of the baby boomers. And with that, you need to put systems in place so you aren't doing everything off the top of your head or figuring it out as you go along the way. Figure it out once. Put a system in place to make it easier the next time. And this allows you now to expand your practice, produce better outcomes, and also to be more profitable and more efficient. So with that, thank you for joining us. Best wishes to you, and we look forward to seeing you in our MedX Pro Network.